I'm going to examine your shoulder since you came in with a shoulder injury today. Looking at it, it looks very normal. I don't see any redness or warmth or bruising. Moving from inspection to palpation, I could palpate on your AC joint. Does that hurt?
No, that doesn't hurt.
How about here on the back of your shoulder?
No, that's okay.
How about here over your biceps tendon?
No, it doesn't hurt there.
Does it hurt to press out here on your greater tuberosity?
Yeah, that's right where it hurts out there.
So after palpation, we'll test some range of motion. So we're going to start with flexion. I want you to bring those arms straight up in front of you. That seems tough compared to your other side.
Yeah, I can't do it on that side.
I'm going to have you do the same thing, but we're going to come out to the side and bring your arms up over your head.
Yeah, I can do this one.
That one also seems tough with that right arm. And then we'll check two others. We'll check external rotation by having you put your hands behind your head.
That's hard on this side.
You can almost get there.
Yeah.
And then internal rotation by putting your hands behind your back.
That's okay.
And that one seems a little bit better too. From here, we'll do some special tests. That way we can see if we can narrow down where your symptoms are coming from. So I'm going to start with having you put your elbows at your sides and pushing out into my hands. We're testing external rotation, and that seems really weak on this side.
Yeah, I can't do that.
We'll test your internal rotation or another rotator cuff muscle next by having you put your hand behind your back and then lifting off of your back. And that's good that you're able to do that test. We'll test a third rotator cuff muscle by having you bring your arms up into a triangle and then turning your thumbs down towards the floor. And I want you to lift this arm up towards me. And that one seems really weak, and we'll have you do the same thing. I'll have you relax this one down and do the same thing on this side, and your strength is really good there. We'll do two other rotator cuff tests to look for pain or impingement. We'll do a Hawkins test. Seems painful. We'll do a second test called the Neers test.
That hurts too.
And both of those seem positive. We'll have you put your arms straight out in front of you and turn your hand up towards the ceiling for a special test called Speeds test. And your strength is really good there on both sides. So your biceps tendon looks okay. The other things that we want to make sure that we check are distal sensation and pulses. So I'm going to feel here for your radial pulse on your wrist. And can you feel me touching you here on your fingers?
Yeah.
Good. How about on this side?
That's good.
Good. Sometimes when my patients have shoulder pain, it can actually be coming from their neck. So I'm going to do one special test that looks at your neck, if that's okay with you.
Okay.
I'm going to have you look up towards the ceiling and then tilt your head towards your arm that hurts. And I'm going to push your head down. Does that reproduce any of your symptoms?
No, that's okay.
Okay.